already have been with us for this afternoon. Let me say hi to Dr. Chong Mei-chan. How are you?
Yeah, good.
Good.
Salam
before,
sejahtera to all. Yeah.
Thank you, Dr. Chong. The team can control the voice noise. Before I start the webinar, let me tell you about my personal perspective based on my experience about aging. So when a year ago, I had a training from the institution, in one institution in Netherlands. And then it's a quite respectable institution. And then it makes my, I have experience with them, with her as an older adult, respectful older adult. But I'm quite shocked and also impressed by his spirit, motivation, physical fitness, and then also he had a dental structure that really great and good than me. So this is quite another perspective for me. I mean, like if the developed countries can make their older adults that healthy, so if I compare with my surrounding, when I saw my people around me, the older adults is quite, I mean, like quite a pity for me. I mean, they don't have really quite good physical health, and then emotional instability, and then the insecurities and so on. So this is really interesting for us to rethinking about preparing about our growing population, and then talking about this topic more deeply, and then starting the issue to make to comes up to the outside of our research program. And then also in Indonesia itself, Dr. Chong, is also have a phenomenon, a major changing. The Ministry of Health also changing the paradigm to make priorities about prevention paradigm to older adults. So they give adequate amount of funding. So this is really interesting to make this topic to discuss by us for today. So Dr. Chong, are you ready for your interesting topic?
Sure. Yeah.
So in this session, I will give you 45 minutes for presentation, and then 15 minutes for question and answer session. So maybe before we start, so what is the highlight for our topics for today?
All right. So thank you very much for giving me the opportunity to share. Today is not so much for teaching, but to share what I have done in Malaysia about older people, right? So today is basically sharing about the evidence base, not only just doing research, yeah, because as Mahat, is it, or Mahathir?
Ray, you can call me Ray.
Okay, Ray, as what you have mentioned, right? In Western country, they are very much advanced, and we are just catching up, yeah. In terms of older care, right? Now as aging is getting increased very much quickly, right? So we really need to look into it, yeah, and provide a better quality of care for older people. Okay, so basically, I'm more on sharing. Yeah, maybe after my presentation, we can have some sort of discussion and see, yeah, and see is there any way that we can actually work together, yeah, to improve the quality of older people in ASEAN region. Yeah, because yes, we are very impressed with the westernized, as what you mentioned in Netherlands, right? Westernized kind of older people care sometimes might not be very suitable for our culture, right?
Yes.
So perhaps we can do better for our older people using the principle, but adapt into our own culture later. Right.
Yes.
So it's more acceptable for the older people. If we bring all the Western idea back, then our older people may not be able to accept it.
Yes.
Yeah.
Okay. Totally agree.
Thank you very much. Yeah.
Nothing further. This is your time to present.
Yeah, and salam sejahtera and good afternoon to Prof Nawati also. I saw her already. Yeah. Thank you, yeah, Prof Nawati for inviting me. Right. So I would like to share my screen. Can you see my slide?
Yes, Dr. Chong.
Okay.
But you have to put this slide. So okay, good.
Is
Thank
it
you.
okay now? Okay.
Yeah, that's okay.
Right. The title of the pamphlet, yeah, of the flyer saying is research, right? Research in aging. So I have tweaked a bit to become evidence-based practice in aged care, because with research, not everybody will have a chance to do research, right? Perhaps we can share what people have done in research in aged care. So evidence-based practice is actually very important. Right. So this is my content outcome. Yeah, the table of content. First of all, I will go through quickly what is evidence-based practice in nursing, how to integrate evidence-based practice into aged care, and research used in evidence-based practice in aged care, good clinical practice and guideline. How does evidence-based practice benefit nurses and older adults, and advantages of evidence-based practice for healthcare system? Right. So I guess most of us here, yeah, for those even students who are doing undergraduate course, you jolly well know what is evidence-based practice in nursing. Yeah, evidence practice in nursing is an integration of research, evidence, clinical expertise, and client's preference. Right. So this problem-solving approach to clinical practice and encourage nurses to provide individualized care. Right, so it's not just research. We also based on the clinical experience. It's also based on the client preference. Yeah, so there are few steps. Yeah, there are altogether 5 steps in evidence-based practice. To go through quickly, from clinical question to identify a problem, gather the best evidence, analyze the evidence, apply the evidence to clinical practice, and assess the result. So if you still can remember, when you do nursing process, most of us know what is nursing process. Do you all practice nursing process in your hospital? Yes? No? You all know what is nursing process? Nursing process. So in nursing process, we assess patient, we ask questions, then we look for we search for information, and then we appraise, and then we implement. We implement nursing care. After implement nursing care, then we evaluate whether our nursing care is effective or not. So in terms of evidence-based practice, it's more or less like nursing process. So far, so good. Am I too fast? Is it okay? Right, yeah? Okay. So step number 1, ask questions. Yeah, we based on PICO. We ask question based on PICO. P means population, patient population. I means intervention or issue. C, comparison intervention or optional, right? And outcome of interest. So in terms of question number 1, population or problem, what are we going to ask? What are the characteristics of the patient and population? We must know who are the population. In this presentation is older people. Yeah, older people. Keluarga lansia, right? What is the condition of disease you are interested in? Yeah. So when we look at population and we look at problem, what we want to know about the problem on older people, right? One of the problem will be frail, right? Frail, yeah. Older people can be very fragile, and then they can have fall. Yeah. Older people can have fall, yeah, more often than the other population. So in terms of PICO, population, patient problem, who are the patient? What is the problem? Intervention or exposure, what do we do to them? Yeah, you know they have problem. How are we going to solve the problem, right? What are they exposed to? Yeah, are they exposed to any chronic illnesses, or they're exposed to malnutrition? Okay, then we compare. What do we compare the intervention with? Right, control. What are the control? Then outcome. What happened and what is the outcome. So in older care example, we can see in terms of population, yeah, older people, senior, right? Older person, senior, over 65 years old. I don't know in Indonesian, what is the cut-off point for older people? In Indonesia, how old you consider is old? Anybody want to help me? Di Indonesia, umur berapa bilangnya
60,
lansia? 60.
It's over 60, Prof. Chong.
Well, 60 is still quite young. I'm going towards 60 as well. So in WHO consider as 65, but it's also up to the local perspective, yeah, patient. And then location is community and community dwelling patient, older people, and the condition, patient characteristic, history of fall. This is one example. So the older people have history of fall. So this is the population we are working on. In terms of intervention, you have to consider how long is the intervention. Is it a full program or fall prevention program? Yeah, fall program or fall prevention program, location in the community, and what type? Traditional rehabilitation and multifactorial fall prevention program in the community. So this is the intervention we are going to give the patient. So in terms of comparison, who are we compared to? Yeah, another intervention, maybe traditional rehab, yeah, physical and occupational therapy only, or no intervention, yeah, no access to fall prevention program, or location of the intervention while in hospital. Right? So you want to compare with what? You are doing some intervention. Who are you compared to? Then the outcome, decreased incident of fall. If we are helping the older people, we teach them how to prevent fall. Obviously, we want them to have decreased incident of fall, right? Decreased incident of fall and the effect. Decreased incident of fall or severity, right? So, and we want to avoid hospitalization. So when they fall, they might have fracture. When they have fracture of bone, they have to admit to hospital. Then avoid subsequent fall. It's very important. To you and me, maybe fall is not a concern, right? Because you are very stable when you walk, when you jump, and when you run. Also, you're very stable. But for older people, they even have a very mild fall can cause a lot of problem to them. Right. Step number 2. Right, so you know you are going to carry out a research or evidence based on older people with fall problem. Then you want to find the best evidence. Right? How do you find the best evidence? Peer review literature. Yeah, you read literature. I'm sure all of you know what is literature. You somehow or other you have referred to some journal article to do your assignment or to do your research. Right? High quality sources. Yeah, you go through Cochrane database. Target the highest possible level of evidence. Usually the highest possible level of evidence is systematic review. High quality randomized clinical trial versus case report. Yeah, so you want to know which evidence is more worth for you to refer, which is more quality, better quality. Yeah, usually randomized is better quality than just case report, because case report might just report 1 or 2 cases, right? So articles has been identified. You already identified an article, then you complete articles. Yeah, the complete articles are retrieved from the internet, local library, or other legitimate sources. Yeah, maybe from other university, right? So you get the relevant article. Then after you get the article, you will evaluate the evidence. Yeah, just like what you did for your literature review. You critically appraise and thoughtful evaluations of the article helps identify if the information is applicable to the client or clinical setting or community. So you have to, so what I present to you just now is more on the community. So you want to look at the journal, whether it's applied to community or hospital, right? Balance new information with one own clinical experience and patient value. So whatever we retrieve the article, some article is westernized country, might not be suitable for our clinical experience and for our patient value, right? Maybe in Indonesia and in Malaysia, we are very much more in favor with religious value, right? Compared to maybe westernized, not so much in still religion value, right? So like in the what setting as well, Okay, so the best evidence is selected from the appraised information. You have to really read many times. Read and read and read on the literature to get the understanding of the point. So then instead for apply information in combination with clinical experience and patient value. Application of best evidence and relevant information to the older adult. Combine the new information with one aged care experience while paying attention to the older adult value. Taking care of older adult is not different from taking care of children. When you're taking care of pediatric patient, we know most of the thing and then we tell them what to do. When we care of older people, we have to look at their opinion because they have lived life experience, right? So we cannot impose everything we read and then we want the older people to follow. We have to discuss with them. We have to get their opinion, right? The selected information or solution is implemented, right? Observation about its effect are made. So you apply, then you have to observe, you have to make assessment. See whatever you have applied, whether it's beneficial to the older people or not. So once we have implement, we want to know the outcome in research process also. We implement the research, we want to know the outcome. We want to know the result. What's the application of the new information or procedure effective to the older people? Should this new information or clinical practice procedure continue to be included in the day-to-day application? If you found it's effective, then you will apply, right? So one way of preventing fall maybe to encourage the older people have very light exercise to strengthen their muscle so that they can more stable feature, right? More stable muscle to be more stabilized so they wouldn't fall. So research used in evidence-based, very often we come across randomized control trial, right, which will give us a very concrete evidence gathered from cohort study, control analysis or observation study, opinion from clinical experts. They are supported by experiences, studies or report from committee, right? So somebody who have take care of older people very for a long time, senior nurses who take care of older people for a long time, they might have more experience, right? And whoever have staying with their parents, older parents or grandparents, they might have more experience, right? Personal experience above 4 categories are listed, descending order for most creditable to less reliable. So randomized is more reliable as compared to personal experience. If I tell you something might not be so convincing, but when you look at the result from randomized control, it will be more promising, right? So in order to know which evidence is more promising, it will be systematic review. Background information, expert opinion, not so reliable, right? So it go upward. So critical appraisal, individual article, critical appraisal topic, and systematic review are more reliable evidence compared to the others. So evidence in aged care. How much evidence do we receive every day? New evidence, right? When you look at it, there are so much of evidence and older care. When you go to Google Scholar, you go to Google search, you just click. Every 0.17 seconds, there will be, I also don't know how to read, 5,910,000, article every 0.17 seconds. There are so many information about aged care in the website, in the internet, and Google itself can give you this number, right? You see, there's so many information out there, right? But the only thing is, how are you going to utilize this information? So whoever want to do research in older care, you have no problem to look for article. Banyak, a lot out there, right? And some renowned journal related to aged care, under WOS, the WOS journal, Web of Science journal, or sometimes we call it ISI. Okay, so this is high impact journal, or maybe some of it is also in Scopus, ranking journal. So gerontology, there are 103 article, 3 journal publish older people article, older adult 84 result, and then geriatric 24, and elderly 6 result, 6 journal. So there are so many journal published aged care research, right? So not necessarily we have to carry out a research. If you go through it, you can utilize the research result, or do an evidence base, then you can utilize the result, right? In Australia, there are a lot of web page. Yeah, you can access for free. Yeah, on Australian Center of Evidence-Based Aged Care, they share a lot of information here. They also upload a lot of what you call that publication and research outcome over this web page. This is organized by La Trobe University, right? You can go to the web page and look for information. And then evidence-based aged care offered by Wiking. This is University of Tasmania in Australia. They have a very good package on preventive dementia. Yeah, they have a course on this, right? Using Future Learn platform, right? It's a very informative. I have attended this course, very informative platform, yeah, to teach people on preventing dementia. It's free online course, but if you want the certificate, they might charge you minimum. Yeah. So, and in Malaysia, we have a lot of society supporting older care. Malaysian Society of Geriatric Medicine is a very informative web page. Yeah, if you have the time, you can also access this, right? They share a lot of information. And this society is very active. Yeah, they used to have conference. In August, they have another conference. You can go to this web page. If you're interested, you can join. The whole conference is talking about aged care only. Right? So they have this every year. And then one of the University Putra Malaysia, they also have their web page on aged care. Yeah. My Aging. The aged care is called My Aging. And then they also conduct a lot of courses for older people. They have this 3M course. Yeah. Have classes teaching the older people how to cook, how to play with the computer, how to retrieve information. And then we also have one association called Malaysian Healthy Aging Society, also very active. They just have one expo, Aging Expo, in one of the shopping mall, KLCC shopping mall in Malaysia last few days, right? The expo have exhibition to show all the new gadgets here for older people care. And then we also, in Malaysia also, we have Alzheimer Disease Foundation Malaysia.
Kan Ayu?
And we also have
program khusus Pak di mana?
Okay, we also have
the audience
Persatuan Gerontology Malaysia. This is in bahasa. In English is Malaysia Gerontology Association. Yeah, I'm one of the member in this association. They also conduct a lot of activity for older people. Right. So in UM we have Malaysian Elder Longitudinal Research. We call it MELO. Right. So this is like 1 million project. Yeah, for 5 years. Yeah, to conduct research in older people. Right. So this is our web page for this research purpose. And after the term for research project over, we still maintain the web page here to encourage those who are interested in doing research in older people will join us. And then we have published more than 100 people in older age care. Yeah, in this research. Right. We also have one research project on PIXA. PIXA means promoting independence in our social, our senior with arthritis. Yeah, senior with arthritis. We have engaging 13 stakeholder. Yeah, stakeholder to call research with this project. Right. And we have aging and age associated disorder research group in our university. So this is a member of the research group. Right. So that is overall in Malaysia what we have, and in UST Malaysia what we have to support older people research care. And for the Department of Nursing, we do we have done quite a number of research, which have been published in the WOS journal. One of it is the effect of chlorhexidine in reducing oral colonization in geriatric patients, a randomized control trial. And our article has been published in Singapore Medical Journal, and we got the prize for in 2006. Yeah, year 2006. So result, the fine 2016, not 2006, 2016. Right, the final sample consists of 35 control and 43 intervention patients. Chlorhexidine was effective in reducing oral colonization compared to routine oral care with oral thymo gargle. The risk of oral bacterial colonization was nearly 3 times higher in thymo gargle compared to the chlorhexidine group. Right, so this is a very important finding, to help the older people to reduce bacterial colonization. And we also have done a research on what influenced the student nurses' intention to work with older people, cross-sectional study. We found a lot of student nurses don't like to work in geriatric ward, which is very sad, right? So we had to do something to encourage student nurses to be more interested, working with older people, right? So a systematic review, psychometric testing, and instrument that measure intention to work with older people. We have done a systematic review on what are the tools to measure the student nurses' intention to work with older people. And we got most cited article in Journal Advanced Nursing in year 2018. And then we also work on a group. I'm sure you also remember how bad is COVID-19. Everybody cannot come out, lockdown. So the older people also locked down. Wow, very dangerous. If the older people stay at home, not moving, a lot of problem. So we conduct a research to do exercise online, right? To see whether feasible to do exercise online or not, right? So of course, the what you call that, the retention rate is very, very low, right? Not many people can follow through the whole research project. And then we found in this research, those doing exercise online, have better emotional state compared to those are not doing exercise, right? We also have a research on association between depression symptom and sarcopenia among community-dwelling older adults across sectional study. People who have sarcopenia tend to have depression symptom compared to a person who have a very good muscle tone. Right, so this is our finding. That's why exercise is very important in older people. Older people must be active. If they are not active, they are losing their muscle. When they lose their muscle, they are not stabilized. When they are not stabilized, what happens? They tend to fall. So that also restricted them from doing a lot of things. They are very scared to go out because they are very scared they will they will fall down. And then once they are sitting at home, they are not communicating with other people, they become isolated. Once they are isolated, they become depression. This is relation from one outcome to the other outcome. So it's very important to keep the older people active. So, and we also have Tai Chi with music, improve quality of life among community dwelling older people with mild to moderate, to increase the quality of life and to reduce depression symptom. Right? This is on depression symptom. The earlier one was on quality of life. Right? They are very active. Every Tuesday and Thursday, this group of people were having their Tai Chi session. Right. So the other group is help benefit of social participation intervention among community during older person review article. Actually, I have this group of people are trained by our project. The Pixar project. So we train them and they become the trainer, and then they participated in one competition. They won first prize of 20,000 Malaysian ringgit. They organize a lot of older people group. They teach Tai Chi. They go and learn dancing, and then they teach other older people dancing. right? So this is a session we have health teaching session with this group of people, right? So, and now they are training other older people in other community, right? So they have one research prize, yeah, 2 times in the council, in one of the urban council, right? So and from this research, we also published a book, yeah, called A Practical Guide to Promoting Social Participation in Senior. How to use community-based participation. And there are a lot of research being done now on Geron technology. They are the study of technology and aging for ensuring an optimal technology environment for all aging and old people up to high age. Right? We can use technology, yeah, to guide them and then to make them go back, especially for dementia patient. They will look at whatever picture can bring them back to the memory lane. Yeah, so they can help them to recall, yeah, whatever they have forgotten, right? And then a lot of technology can help the older people to manage themselves better at home, right? And we know a lot of mobile app, I'm sure in Indonesia it also the same. A lot of mobile app have been set for other disease like diabetic, like maybe cardiac rehab kind of thing. But we high time we had to think of, yeah, to have some mobile app for older people. You see, they're so happy playing, communicate with their children. Yeah, you can also use mobile app to monitor them, yeah, from distance. Yeah, whether they are eating. But sometimes the older people are also very smart. I have a friend, a doctor, right? He used mobile app to monitor his mother, whether the mother take what you call that medication, the BP, right? So okay, all right. So the mother purposely don't want to take hypertensive drug, don't want to take medication, and then the BP very high. Then the son can see, yeah, using the mobile can see the mother BP very high, and then he quickly call the mother. He was worried, why the mother BP so high? The mother say, she purposely don't want to eat the drug, yeah. So when the BP high, then the son will call her. So the old people also very smart, they know how to attract attention, right? So it's getting very important. Yeah, they can communicate with each other using the mobile as well. And then telemedicine also we can use mobile, yeah, to monitor the older people. Right. So this kind of research is getting very popular now. Yeah, people are looking at alternative to help the older people from distance. Right. So from evidence, from research, from evidence, we have gone through this now, and it come out with clinical practice guide. How clinical practice, the guideline, how the guideline derived is all based on the research evidence, right? So in Malaysia, Ministry of Health, we have this warga emas, ya, panduan untuk penjaga warga emas, the guide for caring of older people, ya. So this is the kandungan, ya, amalan cara hidup sehat, tanaman, makanan sehat, keselamatan, penyakit mata, everything related to older people, gangguan tidur, sleeping disorder, right? Cardiac vascular, penyakit jantung. So it's a very comprehensive book. Can find it online. Yeah. And then this is a evidence-based pediatric nursing protocol for best practice, also from research finding. And then this one, if we're getting older, our aging world, right? Ipsos, yeah, knowledge center. You go online, you can see a lot of information from research. Yeah. And then from evidence-based, we also can derive it policy, yeah, social welfare policy and service for elderly. We don't call elderly anymore, we call older people. Yeah, they are very sensitive. Elderly can become very stigmatized, right? A country report in Malaysia, right? So based on the evidence, we can come up with policy in aging population, aging care. Right? In Malaysia, Ministry of Health also have web page on all this elderly policy. Yeah. Okay. Right. So overview. Yeah, this is another guideline by WHO. Yeah, overview, the provision and integrated care is a key for older people. The WHO guideline on integrated care of older people, ICOP, yeah, propose evidence-based recommendation for healthcare professionals to prevent, slow or reverse decline in physical and mental capacity of older people. This recommendation requires country to place the need and preference to older adult at the center to coordinate care. The ICOP guideline will allow country to improve health and well-being for older population and move closer to achievement of universal health coverage for all at all age. Right? So this is a very good guideline. Yeah, will give you a lot of information. Yeah, there is one guideline on how to care for dementia patient. You saw under WHO. Right? So if you have the time, you can access the guideline. Right? So aged care for nurses, yeah, provide scientific research to guide decision, update with new medical protocol for older care, enable nurses to include client in their care plan. For older people, what the older people gain from evidence-based, promote health, to have a proactive role in their own health care, right? Since they can voice concern, share their value and preference, and make suggestions on how they want to proceed and maintain healthy lifestyle. So older people, usually they want to give their opinion. They will not just listen to you because they feel they are older than you, they have more experience, they also can share what is good for them. Yeah. Then in terms of evidence-based, what is the benefit of evidence-based for healthcare system? With the application of evidence-based come better patient outcome, for obviously, which can decrease the demand of healthcare resources. Plus, healthcare organization can reduce expenses. For example, outdated practice may be include suppliers, equipment or product that are no longer necessary for certain procedure or technique. So we need to look at latest technology. What are the nurses' role? The nurses can be a decision maker and coordinator of care, a transferer of knowledge, manage resources and facilitate the success of unit-based, evidence-based work group, encourage research and researcher user, foster a climate of intellectual curiosity, and then the registered nurses utilize current evidence-based nursing knowledge, include research finding to guide the practice in older care. Right. The formulations of evidence-based practice through research, expect the evidence is the foundations of practice. Participate in evidence-based project, disseminate project finding in various forums, right? And collaborate with the healthcare team to provide quality of care. So professional collaboration is very important, right? Thank you. Before I end, I would like to share one video with you. Can you see the video? Can you?
It's still loading, Prof. Chong. Yeah, we can see it, but still loading.
Take a while. What about now?
Yeah, we can see it.
But I can't put it full screen.
You, Professor, you are the hosting person now.
But the video are not full screen. How do I go full screen?
Hello, I'm Nora.
But can you see or not?
I was managing well, despite a few health
Yeah, I can see it clearly.
I've been living there my whole married life, had friends in the neighborhood, and my daughter lived near enough. I'm 85, and my husband died a few years ago. After that, I did start to have a bit of trouble managing around the house. If I'm honest, I felt I was getting a bit forgetful at times. About a year ago, I had a fall at home, and my daughter called the ambulance. I was checked over and returned home quickly enough, but while I was still getting over that, I became sick again with an infection. My daughter started to stay with me more as I wasn't sleeping well. She also helped to make sure I took the right tablets. I was supposed to get home help and see a specialist doctor for older people, a geriatrician doctor, I think. This was taking a long time, and while I was waiting, I had another fall at home, and this time I broke a bone in my pelvis. When I got off the trolley and into a hospital bed between the chicks and the bees, I needed to see. therapists, social workers, and every ologist under the sun. To cut a long story short, I ended up in hospital for weeks. I tried noisy, but kept me awake at night. And I was in a busy ward with people of all ages and stages of life, coming and going with all sorts of problems. I had to keep repeating my story to the nurses, the doctors, by myself. I got lonely. I was upset at times. I hated it. Just the doctor decided I needed a nurse.
At risk earlier and coordinate services better, we will reduce longer hospital stays and avoidable long-term care. So, we will enable older people to stay at home longer. A key change is that we take a long-term approach to anticipating and coordinating older people's care rather than react.
Oops, internet problem.
I see. So, do you want to fix it first, or?
Internet is having problem now.
Yeah, that's okay, Prof.
Kita tunggu ya.
Yes, okay.
Oh, there. Coming.
As a separate episode of care each time they present to health and social care providers. There are many examples of good care evident who need help with everyday tasks. Public health nurses monitor people's health and social needs on an ongoing basis. However, the problem is that even when these services are available, they are not sufficiently coordinated by a named person and who can act as a point of contact that anticipates, plans, and coordinates care with the older person and their carers. Nora would have benefited from the care and support by a primary care team who could have carried out an early holistic evaluation of her health, including her social care needs. This would involve a multidisciplinary team assessment by professionals trained in older persons' care, such as an occupational therapy assessment to suggest modifications or aids to her home. In place to keep her involved with her community. The primary care team would link with a specialist geriatric team if and when required. To coordinate her ongoing needs, Nora would have benefited from a case manager for older persons, who would have worked with Nora and her family to do. This person would act as a point of contact and coordination, who helps Nora to access services early rather than waiting for a crisis to happen. If acute inpatient hospital care was needed, steps could have been taken to improve the likelihood that Nora would have returned home. These steps include a comprehensive geriatric assessment led by a consultant geriatrician and multidisciplinary team at the time of her admission. Admission to inpatient care on a specialist geriatric ward with a healthcare team familiar with managing complex adaptation, and clinical staff with specialist older person knowledge, such as advanced nurse practitioners, manager in the community to coordinate Nora's future care needs. Working together, this team would have developed a longer-term care plan that would be agreed and communicated. Access to practical services in the community would have helped Nora to live comfortably in her own home. These would include help with medication, shopping, and minor repairs. This snapshot of Nora's story shows how the development of an integrated care program for older people is a priority for our health and social care services. The team leading this program are meeting and working with health and social care professionals nationwide to plan how existing care can be better coordinated to benefit older people and staff working with them. This seeks to build on a shared local vision that builds a population-based approach to integrated care that is person-centered, planned, and coordinated. Find out more about integrated care services at www.hse.ie/Nora.
How do I off this now? Ha ha ha.
Okay.
Wait. How do I off this?
Yes.
How do I get rid of this?
Maybe
Maybe I stop sharing. I stop
video.
sharing.
Yeah, you can do it also.
Okay, right. I love this video. It's actually very short but very meaningful, right? So the moral of the story for this video is we have to take care. We have to how to say? We need to have interprofessional care for the older people. Yeah, we need to collaborate with different discipline of people. Stay stable in the community and keep away from hospital. Actually, when older people stay in hospital, it's not very how to say very good for them because they're exposed to a lot of infection kind of thing, and then they will feel very depressed, right? So from the video, I really agree with them. Integration care is very important in the community. We can keep the old people at home as long as possible, right? And when they discharge from hospital, so we need to have a very comprehensive care for the older people so that they don't have to have readmission to the hospital. Yeah, and then they can live more happily if they can be independent. I don't know in Indonesia, but in Malaysian, the older people around me, they don't want to trouble people. They want to live independently. They want to feel they are worth living, right? They do have value, and they want to contribute in the family.
Yeah, I think so.
That's my opinion. Yeah, thank you very much for your attention.
Yeah, thank you very much for Professor Chong to explain about her presentation for this afternoon. This is really interesting that she was told us about the intriguing and interesting topic about evidence-based practice that we should take care for our older adults. And then she also mentioned about the implementation of the good best practice in Malaysia and in every countries that we can also get an insight from the perspective. And then also she also talked about the trends about get on technology or anything that related to make our older adult getting better in their life. And also it is really interesting your video that you showed ours before, because it really if I am living as Nora, it will be comfortable for me and then more secure for me to live as an older adult if we provided specific care and then the multi-dimensional and multi collaborative relation between healthcare system that we provide for our older adults. So we move on to the next session. Thank you, Professor Chong, for your interesting explanation before. And we move on to the next sessions. I would like to ask the audience to give some queries or question to the related topics that makes our discussion is getting warmer, interesting. So if anyone in here wants to talk about their queries, please raise your hand, or you can type the question on that chat. So I also saw there are so many few questions from two questions from Fitri Mailani. Ibu Fitri Mailani wants to ask, dear Professor Chong, I think I want your example from your own perspective and your own experience about the implementation at your setting and context about the good case practice of the good implementation, the evidence practice in older care you have mentioned before, but based on your like your experience in research, maybe you could tell her about what is your experience about that. And then the second question, so Bu Mailan asked Professor Chong about if we talk about get on technology in Malaysia, maybe they have the ability to use mobile phone, but in our setting and context, it's quite hard to make older adults in Indonesian people to get mobile phone or technology. So how does Malaysia, handle the situation or this type of issue that we can implement the get on technology itself? And then also we have last question from Rima Berlian Putri, maybe. Please, you can ask your question by your own private microphone, please, Bu Rima.
Thank you, Pak Mahat.
Yeah.
Good afternoon, Rick, and good afternoon, Dr. Chong.
Yeah, good afternoon. Yeah.
Thank you for the opportunity. My name is Rima from Tarumanagara University, Jakarta. I'm very interested to the topic that you present. Maybe just some information for you. In Indonesia, the older people usually live with their families, like their daughter or their son, and the caregivers for the elderly are usually also the family. My question is, in evidence-based, how do we measure the right quality of the data and extract the data correctly? So sometimes I still confused about after I read some article, and I feel confused to how to measure the right quality of data and doing the extract the data correctly. Thank you for the opportunity.
Okay, thank you for your question, Rima. Right. Yeah. How to extract the right? Okay. How to extract the right quality? Usually, when we read the article, we need to base on the guideline. Yeah, the guideline how to appraise what kind of obviously a person who want to read the article, you must have some research background. You must understand some research background, right? And I mentioned in terms of the data validity, yeah, the trustworthy of the data is like the pyramid, right? So if we read one article, maybe somebody have done a research on how to prevent fall, and then the sample size is only 5 people, right? So obviously it is not very valid. Yeah, the statistic is not valid. You might not be able to base on that research, right? But usually in a proper systematic review article will give you a very valid evidence, right? So the valid evidence, if you can go to your retrieve some journal on systematic review, that will be fine. And RCT, of course, how to identify whether the evidence is reliable or not reliable, you have to look at the research procedure, whether the just procedure is robust or not robust. So you need to have some idea whether the sample size is random or the sample size is convenient. It also makes a difference, right? Whether the sample size is big enough. If the sample size is only in one province, only in Surabaya, maybe not valid to Padang, maybe not valid to Jakarta. So all these things you have to analyze. Yeah, if you read some article from Western country, hari-hari makan sausage, right? And makan whatever cheese and all that. Maybe in Indonesia, all people won't eat cheese. Mediterranean diet is not suitable for people in Indonesia. Indonesia mesti makan nasi, right? You eat rice, right? You eat more what you call that? Ulam. Bisa makan ulam like Indonesia. You all call ulam also. Salad. Local salad, bukan salad the Western people. Salad Indonesia lain. Yeah, maybe you eat a lot of jamu. So bila kita nak guna the evidence, we have to fikir, we have to think whether the evidence sesuai tak untuk older people in my setting, right? So this is the thing you need to consider as well, right? You will talk about cycling in Netherlands. I'm sure Ray have seen a lot of people cycling in Netherlands, right? Yeah. But Indonesia, maybe still some people still cycling, yeah. But different kind of cycling, yeah. So kalau in Malaysia and Indonesia older time, kalau kita cycling naik bicycle, orang yang miskin, poor people only cycling, but now orang kaya, rich people only cycling. Kan bicycle dia kan beribu-ribu ringgit, ya. So it's a different. That one cycling is for health, right? Those day people cycling is for convenient, as a means of transport. So different, right? In terms of tempo also different time. Kalau kita nak buat mobile app research, joran technology research, when we want to look for article, janganlah article in 90, in 80, jauh beza kan? Right? So you need to get the article later one. Kalau kita nak buat anything about COVID, so article mesti within the 3 year or 5 year. Right? You look at article lama-lama memang no COVID already. So this is the thing that you need to evaluate. Yeah? Not all the time, everything published in article is valid. Betul. Sahih. Not necessary. You have to read with your own wisdom. Yeah, some like statistic is not very valid. You have to query them. For drug company, pharmaceutical company, ubat-ubat, yeah, research on ubat-ubat. When you go conference, when we attend conference, in front of the conference room, there will be a lot of pharmaceutical company board, right? Then there will have a lot of article on the table. You get what I mean? Then you baca article tu, out of 10 article, all 10 article mesti significant, the finding. Why? Sebab sample size dia besar. Beribu-ribu sample size. Thousand and thousand of sample size. Of course, the result will be significant. It will affect by the sample size. Right? So, and then there are drug company. Of course, they will say their drug is good. Kan? Right? So, you have to question that. Yeah? Any conflict of interest or not? Am I answer your question, Ibu Rima?
How is it, Bu Rima?
Yeah, thank you, Dr. Chong, for your explanation. Thank you, Dr. Ray.
Yeah,
Back to the first question.
Yeah.
The first question, experience. Yeah, how to take care of older people. It will be very difficult for me to say how. Yeah, it's all come from your own your passion, your compassion to nursing, right? To me, as a nurse, you are born to that kind of calling, yeah, to be good to people. And of course, we need to encourage, yeah, the student nurse, yeah, to be more caring. All these have to start from when they are student, right? And as a lecturer or as a nurse, a senior nurse, has to be a role model. And then all these also started from home, yeah. For those staying with grandparents, staying with parents who are older people, yeah, you tend to be more caring compared to those who are not staying with older people at home, because you are exposed to them, right? And we should read more article. We should have more experience, like what Ray was mentioned just now. Yeah, we go to Netherlands, you see all the older people so active, kind of thing. Then you expose yourself. Yeah, some old people like our ex Prime Minister Tun Mahathir. I think some of you may heard about his name. He's 100 years old already now. He still want to be active in politics. But sometimes too old, talk too many things, make people angry also, right? But he is so active, 100 years still can work. And then some people 100 years already still can start dancing, right? It is how you motivate them. Don't make the older people feel old. Yeah, when you have older people, you have grandparents at home, don't think that they are too old to do anything. You must get them involved in the household activity. Must give them a chance to make decision. Yeah, if I am parents, I am your father, I'm your mother, I cannot say anything. Everything you have to follow, especially as when the children is nurse and doctor. They keep asking the parent, you must eat medicine, you must eat medicine. You diabetic, you cannot eat something sweet. No, this one cannot eat. Sometimes the treatment really change. Yeah, for very old people, sometimes the doctor say okay for them to eat whatever they want to eat, they eat. But later they have to take more medication. They have to have higher dose of insulin because this is quality of life. Berapa tahun lagi ya orang langsir ni nak hidup lagi, you must have quality of life. This one cannot eat, that one cannot eat. It's very difficult. And then we cannot restrict the older people gerak-geri, their mobility. We don't allow our parents to go out because nanti dia keluar, dia jatuh, masalah besar, problem. No, right? We cannot lock that. That's why parents sometimes I've interviewed some parents, they feel very frustrated. My children don't allow me to go out, just like we don't allow our young children to go out. You tend to get that kind of feeling, right? So older people need to go out and mix around with people, talk to people who is their age, who are at their age. Then they understand each other better. Sometimes it's just talking to friends, make their life very meaningful, right? So did I answer your question? Memang most of the young nurses don't like to work in geriatric ward. Why? Sebab all need full attention, all bedridden, all need nursing care, full nursing care. That's why they feel very tired. Yeah. But every now and then we have to reflect, especially like Muslim, you need to reflect every night. Yeah, before you sleep, you reflect. When you get out, reflect. One day we are also moving to that end. Yeah, we will get old also one day. So when we get old, we get this kind of treatment. Do you like it? You don't like it, correct? So we need to respect, build up the respect. In terms of mobile, in Indonesia, memang older people won't use mobile, is it? Ada kan? Getting more and more common already.
Yeah, I think yes, but in limited.
Tapi the mobile, mana dia dapat mobile sebab Bapak Ray nak tukar mobile baru, dia bagi mobile lama kat bapak dia. So the mobile not so good. Right.
That's what people do, I think.
Selalu dia macam tu, ya. Anak-anak nak tukar mobile baru, dia bagi mobile tu kat ibu bapanya. Shouldn't be like that. Beli mobile baru kat bapak, ya. Right. So teknologi memang macam tu, ya. Teknologi macam tu. We cannot think technology is so expensive. People cannot use. We don't want to develop technology. Ya, peringkat awal technology devolve, ya, evolution of technology can be very expensive. Like those days, nak beli TV, ya, television, only black and white, also very expensive. Only one house, ya. Even during my childhood, I also go to my neighbor house to watch TV. Not everybody have TV. Television, now in Indonesia, semua rumah ada television, right? Okay, so technology evolve, and when technology it become more useful, it will become cheaper. Right? And people can access to it. We cannot say so expensive, then we stop. Nobody should stop technology advancement. Right? Of course, anything new, they will be expensive. And more people using it, it becomes cheap. Just like now, everybody can have mobile. I cannot think of this 20 years ago, we use mobile phone, right? We will make a call at the public phone. Kat tepi jalan, public phone, no mobile phone, right? But now everybody got mobile phone. I think they will come, we will be able to make the older people use technology. Yeah.
So do you think if we wants to get into on technology, so do we have to provide them with specific training to use the mobile phone itself, or facilitate them with the
yes, of course we have to teach them, but we need to make it very user friendly, not too many steps. The prototype must be simple to use. Just like when we teach our students last time, the earlier part of the LMS not very useful, right? Not very friendly, right? Learning management system. Now we add in more thing already, more interactive. As things move on, we will improve on it. But for older people, must be bright enough. The color must be bright enough, and then all the icon must be big enough for them to see.
Yeah, I think so.
Yeah.
Yeah. Thank you, Professor Chong. Actually, we have run out of our time, but we still have the last one. Dear Professor Chong, what should we do as a nurse for the first step to build healthy home for older people in our community? Thank you. What should we do as a nurse for the first step to build healthy home for older people in our community. I mean, like how we provide in the community context to
Okay,
to
as
all
a nurse,
people,
yeah, we cannot build a house for them, right? As a nurse, we cannot buy furniture for them. We cannot give them money. So what can we do? We educate them. Yeah. So when you visit the home, you have to assess the house, yeah, and teach them how to make the home more safety for the older people, not too many furniture, how to arrange the furniture. So you have to nurse play an important role in giving health education, health teaching, right? So, and everything start from home. You yourself with your parents, you teach your parents, you teach your grandparents, start from home, and then expand to other people, right? So you have to educate. Our role is more on education because we cannot give money, we cannot build a house for them, right?
Yes.
So get more involved in community activity. If you have any celebrations with older people, we join them, and then we encourage intergeneration activity, right?
Yeah.
If you have Hari Raya, you have open house, or you have anything, get all the different generation come in and help each other, right?
So there must be more involved, Professor Chang. Yeah.
Yeah.
Okay. Thank you, Professor Chang.
Thank you. Yeah, thank you for your
For
attention.
your answer, I mean, yeah, it is really nice to meet you in here, Professor Chong. There are so many issues that we have discussed, and then also there are interesting questions that you have answered also. So, but we don't have any long time to still discuss with this topic.
Right.
But I'm, as your host, really grateful, and also the audience, of course, feeling grateful for your presence.
Yeah.
Yeah.
Thank
And
you.
then
Okay,
we
bye-bye.
also, thank you very much, Professor
thank you.
Chang. And then also, you want to say something for the last
You are
time?
very good moderator.
Yeah,
Yeah,
thank you. Bring me to Malaysia.
Yeah, come.
Okay.
Welcome to Malaysia. Yeah.
Yeah, of course, I will go to Malaysia.
Yeah.
Okay. And also thank you for the audience. It is really nice to meet you here to discuss together about research in aging and then the evidence-based practice in older adults. Thank you, people, and then see you again in the next public lecture. I'm your host, Ray. Yeah, bye-bye.
Bye.
Bapak Ibu yang belum mengisi absen, mohon please fill in your ya, silakan Ibu. Silakan isi absennya terlebih dahulu ya Ibu, Bapak yang hadir. Terima kasih.
Aduh, pada ini ya.
Jadi campurnya dengan nasi.
Nah.